let me show you a case where I'm going to be using a universal composite to close a diastema. I think that universal composites are great for diastema closures because they're typically smaller spaces. We want the height to width ratio to be about 75 to 85%. So let's say that a patient comes in and they want us to close their diastema. Well, I'm quickly doing this calculation. I am measuring the height of the tooth, and then I'm going to consider how wide can I really make this tooth in order to close the diastema where it doesn't begin to look like a chiclet. Once it starts to go beyond 85%, or maybe even we're looking at a 1-to-1 ratio, that's when the tooth is getting far too wide. Likewise, if let's say a patient comes in and both 8 and 9 are fractured, then I need to know a rough idea of how long can I make the central incisor. Generally, the average length for central incisors is about 10 to 12 millimeters. Also, these are averages, so we want to know what fits into their face. But those are really important numbers to know. Once we know the lengths of the centrals and we just keep that in mind, that's going to direct everything else. This is how the patient initially presented. I used rubber dam isolation. And so I do this to help get all of the tissue out of the way. And I actually am doing a freehand technique with the composite. I'm not using any sort of matrix at all. But so what I do is I will build up the tooth and I'm going to show you this a bit on the dentiform tooth. I'm going to build up the tooth and then I'm going to be using a sanding strip. This will help to smooth it so that we don't have really any sort of micromechanical retention, but also to get rid of the oxygen inhibited layer on the composite so it's not curing to the adjacent tooth. Then I'm going to build up the other tooth. And then finally, I'm going to slightly separate the tooth with a thick composite instrument, or also known as torquing the tooth. I'm forewarning the patient because they're going to hear a pop, which is quite alarming to them, but no need to be alarmed. And I just want to be really conscientious that I'm not using a very fine composite instrument, some of my sculpting type of instruments, because they will break. Then, just as I mentioned, if I'm not using pencil, I also love to use cake batter or cupcake type of spray. It's very cheap. Once you go ahead and let it dry, this is where you get this fine detail. This will tell me right here, this lining was a bit off. I have some surface irregularities that I need to smooth out. It gives me a lot of helpful details. And so then there's the final case. The patient was elated. He did not want ortho to close the diastema. So this was a great outcome done really within 90 minutes. Case selection is important. And so we're using the same technique with the composite shade match where I'm putting it in the right place. Then from there, I'm going to build up the tooth with the Ecosite 1 on number 8. Just using a fine composite instrument. This is really the only composite that I'm using. And I'm just further sculpting it now with a sculpting type of resin. And so what you'll appreciate here, because the teeth are regularly shaped, there's a bit of an optical illusion. I took this case, I loaded this into Keynote, and then believe it or not, this blue line right here is the same length as this pink line. But number 8 artificially already looks like it's going to be much wider than number 9. But when I'm using Keynote, this actually tells me that I'm actually perfectly right in the middle. So I did a freehand type of technique. Then from there, I'm using the sanding strip to smooth out the composite, get rid of any sort of irregularities that might cause micromechanical retention, or to get rid of the oxygen inhibited layer so that it doesn't cure to the adjacent tooth or to the adjacent buildup. So then there's the final outcome. So you'll really appreciate a beautiful shade match.